Good morning, friends. Today we will discuss about the examination of nervous system. Whenever we learn nervous system, we have seen that nervous system has many functions, infinite number of functions, but all the functions can be categorized into three types: sensory functions, motor functions, and integrative functions. So, first type of functions in the nervous system are sensory functions, and today we will see the examination of the sensory nervous system. How you will check the sensory nervous system in a normal individual or a patient, that we will see today. We should remember that clinical examination of sensory nervous system, whenever we go, we should remember that there are some terms which we should remember. Important symptoms related with sensory system are pain. Number 2, loss of all sensations. Number 3, loss of pain sensations only. Number 4, altered sensations such as the tingling, numbness, pricking of pins, etc., and uncoordinated movements. That means whenever patient comes to you, patient used to tell these type of symptoms, and when you see that patient is suffering from these symptoms, you go for the detailed examination of the nervous system, and specifically you should check a sensory nervous system in the patient. Now we'll remember the plan of examination of the sensory nervous system. Before that, we should remember the different type of the sensations are there. So you have to check the sensations. Then how will you check it? Number 1, tactile sensation. Number 2, you have to check the pressure. Number 3, cutaneous pain is type of pain. Number 4, deep pain. Number 5, temperature. Number 6, joint sense. Number 7, vibration sense. Number 8, stereognosis. Number 9, tropic sense. And number 10 is sensory ataxia. So in this way, you should go for the examination of sensory nervous system. Now we'll see one by one. For this purpose, to check the sensory nervous system, you require some material like cotton wool, paper pin, tuning fork, various coins, test tube containing hot and cold water, and aesthesiometer which use in the school campus. Now procedure. Subject should be blindfolded in all the tests. So the subject should not be know the details about what we are going to check. Then identical dermatomes should be tested. You are aware of the term dermatomes. Dermatomes are the area of the superficial body, and on the basis of these body parts, different dermatomes are described in the nervous system. For each and every dermatome, different nerve supply is there. So, when you observe that in a particular dermatome, a sensory function is decreased, then you can conclude about the nerve which may have been cut or which may have been atrophied. For example, the nerves, specifically spinal nerves, some spinal nerves are you knew about the cranial nerve, sorry, spinal nerves may be arriving from the cervical spinal nerve, then thoracic spinal nerve, then lumbar spinal nerve. These different type of the nerve, and again their number is different. They supply the different dermatomes on the body. So whenever you found any problem in particular dermatome, you should conclude that the particular number of nerve may have got the pathological change. Now, tactile sensations are also called as topogenesis, is done by the cotton thread and can also be done by the bone phrase hair aesthesiometer. Tactile discrimination is the ability to distinguish two different stimuli as the separate entities. Test it with the compass aesthesiometer. Reduce the difference between the 2 points slowly. Normal figures are different at the different places. Just like on the back it is area is big 70 millimeters. Dorsum of the forearm it becomes 15 to 20 millimeters. On fingers 2 to 5 millimeters, on tongue it is 2 millimeters. So you have to place this aesthesiometer which has two ends and blunt end on the skin, and you ask the subject whether he can identify the sensation of touch. Now pressure, to check the pressure, test it by pressing firmly with the blunt tip such as the back of the pen. Then cutaneous pain. For checking of the cutaneous pain, prick the skin with the pin, but do not press it heavily, otherwise bleeding will be there. Just whenever you test all the things, you ask the subject whether he can feel that pain or not. When you check the deep pain, you have to pain the muscle tendon. So the pain from the muscle tendon is a deep pain. Pain from the skin is a cutaneous pain. Temperature. There are two types again, hot temperature and cold temperature. Use two test tube, one containing cold water and another containing warm water. Then interchange these test tubes frequently so that the subject cannot guess which is being used. And by touching a test tube containing cold water one time and hot water another time, you ask the subject which water is there inside the tube, whether hot or cold, and just note whether he can identify it or not. That means temperature or thermal receptors are normal, so the temperature sense is also normal. Then joint sense. For this purpose, you have first of all to decide whether the subject is aware of the sense of position. Move the limb passively in the various directions through the air, finally leaving it in some definite position. Ask the subject to keep the other limb in similar in. So here you should lift a limb, you move it and put it in the some position and ask the subject to do the same thing with the another limb, whether he can do it or not. Then you will able to realize the sense of position. Adjust the position of a great toe or a thumb and ask the subject of identify the position. Here you have to lift the great toe or thumb, we have to move it and ask the subject in which position that thumb or great toe is. Here you will conclude about the sense of position. Now another method to identify the sense of position is appreciation of the moment. This is closely related to the sense of position and therefore should be tested at the same time. Now, for this, grasp any segment or a limb firmly and then move gradually another. Ask the subject to recognize the segment of limb which is being grasped. You have to grasp one limb. You have to do another also. And ask the subject which segment of the limb is being grasped. If he is able to identify, then his joint sense is normal. As soon as he recognizes the moment and state of angle through which the limb is moved, normally moment of 10 degrees can be appreciated in all joints. This is the way to identify the sense of movement. Then one more method is there, test if the patient can recognize the direction of movement, like whether the joint is flexed or extended, specially tested in big toe and thumb. Whether patient or a subject is able to identify the direction of movement. Here these are the ways how you can test the joint cells. These all tests can be done in a subject. Subject means a person, individual, or normal person. These tests are find not normal in the patients. So you can check it in the subject as well as the patient also. Then after comparison, you will understand the examination of the nervous system. Now we can check the vibration sense also. For this purpose, test it by placing tuning fork. You are aware that the tuning fork is used for the sensation of hearing. Whether the hearing, air conduction and bone conduction, comparison between air conduction and bone conduction. But this tuning fork can vibrate. So to check the vibration sense, you can check the tuning fork. You can check the tuning fork with of low pitch of 128 CPS on the bony prominence, like there are some specific locations: shin of the tibia, mastoid process, olecranon, lateral and medial malleoli of the subject. In these places you can check the vibration sense. Ask him whether he perceives vibration. As soon as he stops perceiving vibration, transfer the fork on you. Thus the sensation of vibration of the subject and yourself can be tested. Both of things can be tested. This is the way to check the vibration sense. Stereognosis is the ability to identify familiar object from its size, shape, weight and texture by asking the blindfolded subject to identify the different coins. Now you close the eyes of the subject, you put different coins in his hand and ask him which coin it, whether it is 10 rupees coin or a 5 rupees coin or 1 rupee coin. If he is able to identify, then stereognostic function of the patient is normal. Then topic changes. When nerve supply of any part is cut off, nutrition suffers. An unusual protective mechanism like withdrawal reflexes due to pain are also operative. You will observe that the skin becomes bluish, shiny, cold, thin, ultimately leading to the ulcer. Then you will observe muscle atrophy. You will observe bones becoming brittle and susceptible to the fracture. The joints hypermobile due to the decreased intracellular tissue and laxity of the ligaments. These changes you will observe in a patient. So these changes are called as the tropic changes in the nervous system. Then you can examine the spine also, spinal cord. First of all, you should look for the deformity of abdominal swelling in the region, whether on the abdomen or spine is there any deformity or swelling, whether the spinal cord is normal in structure or it has got various shapes which are not normal. Then you can check for the tenderness, elicit the pressing the head in the sitting position and ask the subject to point out the level where he feels pain. Ask the subject to sit, ask the subject to bend forward and you ask whether he has any pain. If he has pain, then at what angle he is having pain, so that you will able to judge the lumbar nerve or a thoracic nerve from which the pain arises. Test for the tenderness, pressing side to side upon each spinal process by percussing the spinal process. By this method also you can check whether tenderness is present or not. Sometimes in patients pain is there, but pain is not always there. The pain is there whenever such a part is bent and he cannot live in the same position. That is called as tenderness. You cannot touch his part of that body. Then you can check the movement. See whether your subject is able to do forward bending, extension, lateral bending, rotation of the pelvis fixed. These are the methods to check the movement of the spine. These examinations, as we are studying today, as a part of examination of nervous system, but these examinations are also related with the examination of a joint also. So whenever we see joint examination, the same things can be repeated, or in the patient whenever you go for this examination, be sure that you are checking both of the things, the joint examination as well as nervous system examination. We should remember some terms which are related with the nervous system. Anesthesia means loss of all form of sensation. Patient do not have any sensation. When through medication anesthesia is given, patient becomes such a position that he don't feel any kind of a sensation. You can operate the patients also during anesthesia. Then analgesia is loss of pain sensation. Sometimes patient do not feel pain, but that may be analgesia. Paresthesia is an unusual sensation, spontaneous in origin and can be described as pricking, tingling, numbness, burning. Sometimes patient complains, I have a burning, I have a numbness, I have a tingling, I have pricking, and these pains occur spontaneously at any time. That symptom or clinical feature is called as paresthesia. The root pain is spontaneous severe pain due to the disease process involving root fiber. Then dermatomes are the area of a skin innervated by single spinal segment is called dermatomes. We will keep these terms in mind. We will remember all the way to check the subject specifically for the examination of nervous system, and this is the first part of the nervous system, that is examination of sensory nervous system. So in the next lecture we will see the examination of motor nervous system. So sensory part can be examined in this way. Thank you. Have a good day.